Hi, everyone. My name's Kim Wind. I'm a physical therapist who works for Sway Medical. So today I'm going to give you guys just kind of that clinical overview of how to use Sway in the clinic, certainly for your concussion patients, but also as an objective balance tool, balance and cognitive tool. This is something that I did before I came to Sway. I was a customer and had to convince upper management of why I wanted to use this software and technology in my clinic. So let's dive in. A few objectives for today. There's going to be different sections, so feel free to skip ahead if that's something you need to do. We'll do a quick overview of the Sway platform and dive into all of the testing modules that are available. Go through some patient populations, most importantly, talk about how it's going to fit into your workflow, and go through some reimbursement and Medicare billing codes. So, a quick overview of Sway. As most of you hopefully know, Sway is concussion management that is mobile. Everything can be done on a mobile device. And in fact, the testing must be done on a mobile device because we use the accelerometers in the phone to measure your balance and cognition. So Sway's been around for quite some time. In February of last year, we received our FDA clearance for concussion management. So that was a big milestone, and a lot of research went into that. This is a few of our members of our research advisory board, mostly all in the concussion realm. Some really big names here, and very privileged to be able to have this group advise our product to be pushed in the right direction. So for Sway, just from an overview standpoint, there's always a mobile app where the testing data can be seen and the test has to be administered. As healthcare providers, you also have access to all of the data on a secure web portal. So a quick overview of all the testing modules that are available on Sway. This is really like the bread and butter here. So all of these modules are available to folks that have a Sway clinical subscription. The tests in the blue are our different balance modules, which we'll go through in just a bit. We have a 30-second chair stand test. That test is available for use. We're still collecting normative data on that. And then all of the purple ones are our cognitive modules and gray are our surveys. Most of the surveys are all concussion based. The sleep survey is the 5-question sleep survey from the SCOT-6, and symptoms are also from the SCAT, same thing, on-field assessment. VOMS is a really nice one. There's a built-in metronome, and it just helps standardize the instructions when you're administering a VOMS test. PHQ-9 and GAD-7, those are your anxiety and depression screeners. So for this group, I definitely want to spend some time on the balance modules. This was really important to me as a clinician because I didn't have force plates in my clinic. I wasn't getting them anytime soon. So Sway gave me an objective way to measure balance instead of using good, fair, poor. Graduated PT school a long time ago, don't necessarily remember all the ins and outs of those definitions. So when you take a test, a balance test on Sway, it's scored on a 0 to 100 scale, 100 being the best. So all of the instructions for any of our balance modules have visual and written instructions. And our MBEST test, you can see the stances listed here. The eyes are closed for all of those. This is a very challenging test. Of our 3 balance modules, I consider this one the most challenging, kind of the highest level reserved for your athletes. This is the one that all of our concussion patients are using. It's part of the SCAT-6. The modified CAT-SIB, I'm sure everyone is familiar with, a great test to pull out that vestibular dysfunction. It does require an AirX pad, and it puts patients through all the different stances, eyes open, eyes closed, on foam versus not on foam. This one does take a little bit longer. It's 30 seconds per stance. And I didn't mention on the last one, our MBEST test is 10 seconds per stance. We have research and did a ton of research in developing that to ensure that the 10-second MBEST stance on Sway correlates and is the same as the traditional 20-second, pen and paper MBEST. So, we did a lot of studies to make sure that the 10 seconds was enough time for the accelerometers in the phone to get an accurate measure of your balance. Modified CAT-SIB, because the stances are easier, that one is 30 seconds. And then we also, for your older adult, have the CDC 4-stage. So eyes are open for all of these stances, and this is just another great one for those older adults and fall risk patients. So when you take a balance test on Sway, instructions will pop up on the screen, as I mentioned, visual and written instructions. The patient will press start test and they have 3 seconds to bring the device up to their chest or their sternum with two hands over. And they'll stand there. Obviously, if the patient has impaired balance in any way, you would guard them just as you normally would um, when you're assessing for balance. So we'll talk through also all of our testing modules have normative data down to as low as age 9 all the way through age 90. Now, some of those balance tests, like that CDC 4 stage, that one is age 60 through 90 versus our MBES, which is more for that younger population, goes from 9 to about age 60. Okay. I'll dive in quickly to some of our cognitive modules. I do think for physical therapists, especially, or folks that don't necessarily do cognitive therapy, but want to gain insight as to what's going on from a cognitive standpoint in your patients with concussion, but even your older adults who may have some cognitive decline or things of that nature. It's really nice to have some objective measures to actually see what's going on, and hopefully your interventions are playing a role in that. So the first cognitive module is inspection time. Two T's pop up on the screen. One stem is longer than the other, and it gets covered up by a blue rectangle. So this is a measure of visual processing speed, and they're going to tap which T is longer. And this is a hard test. They have to stay focused from an attention standpoint on this test. And if they get it correct, it gets covered up faster. If they get it wrong, it gets covered up a little bit slower. So it's a performance-based test based on how they do each trial. Next up is our reaction time test. So this is a really cool one that one of our company patents is around, and we use the accelerometers in the mobile device to measure someone's reaction time. So the screen's going to light up orange, and the patient will be asked to move the phone when it turns orange. So it's a really accurate representation of what that neuromotor response is. There's a lot less latency than clicking a mouse. The mouse sends the message to the computer and whatnot. This is all based on that first intentional movement. It could be down, sideways, forward. Any intentional movement will trigger that response. Now, impulse control is a very similar test. It uses the same principles in terms of that using the accelerometers for assessing movement. But now the patient is given a go or no-go stimulus, green check or red X. On the green, move it. On the red, hold it still. For folks that are colorblind, this still works for them. We make sure that we're ADA compliant for all of our testing modules. They can see the check mark or the X even if they can't see the colors. And then last is our memory test. So there's a working memory and a delayed recall portion of this test. 3 letters will pop up on the screen initially. They're asked to memorize those letters. And then they'll do a working memory portion where they play a Simon Says game. They have to repeat the pattern that they see of those squares. Once they fail the pattern of the squares, then they're asked to recall what those 3 letters were that they initially saw. And they'll receive a memory score based on a 0 to 100 scale, 100 being the best. And I didn't mention before, all of our other modules, the t-test, reaction time, impulse control, those are scored in milliseconds. So the faster you go, the better or higher percentile score you'll see and they'll have. We do have 2 other cognitive modules that I think are really great for those concussion cases that have delayed recovery or that you're getting ready to send to a neuropsychologist for a further workup, or you're just kind of stuck on there. Some cognitive pieces that are symptoms that they might be reporting and you just can't really get to the bottom of. So these are just more in-depth modules that folks will administer in that post-injury phase. Reverse number counting is pretty straightforward when it comes to the name of the test. Boxes will pop up on the screen numbered 1 through 20, and they have to tap the numbers in reverse order. That number will be scored in milliseconds. And lastly is our Kuhn-Strut test. This is a very challenging test, and it holds up really well to a traditional pen and paper Stroop. So as you work with whether it's a psychologist or neuropsychologist on some complex concussion patients, this is some testing data that that group really likes to see and can be helpful in managing those patients. So again, all of these modules on this wheel are available when you have a Sway clinical subscription, and you guys have the ability to pick and choose which modules you want to use for a patient. We'll talk through that a little bit on the workflow side of it. So next up is just kind of an overview of patient populations. This slide is always near and dear to my heart. I used it in presentations that I gave to my upper management. And really just from the idea that this technology at its core is objective, balance, and cognitive assessments. So that really, of course, it could be used on my concussion patients, and that's what I was pushing it for. That's how I learned about it. But I ended up using it on ankle ORIFs, where I was going to measure static balance anyways, but I had a more objective way to do it, better visualizations to show the patients their improvement. With our ACL return to play patients, right? We're doing so many different isokinetic testing, all the things. This was a way to just get another objective measure in there. So really it's as creative as you want to get. With every Sway test, no matter what type of patient you do it on or how many modules you choose to administer, there's always going to be a clinical report that can be downloaded into a PDF. And that's something that you might need for some documentation, and you could also attach to the medical record. And we'll talk through that in some of our upcoming sections. So next, which is really the most important piece in a busy, clinic, especially if it's outpatient, I've been there. Technology is great, but if it doesn't fit into your workflow, it's just not going to happen. So we'll talk some ways that Sway has been successful in clinics and what works best for folks. So really, there's two ways to take a Sway test. You can take it, the patient can take it on their personal device. However, we found that our most successful clinics will have the patient take a test on a clinic device. So that could be a clinic iPad. It could be the provider's phone. I never really liked giving patients my phone, but we had an iPad in the clinic where I was able to get the patient set up versus having my injured patients have to download an app and try to remember their Apple ID, all of those things. So I'm going to walk you guys through that first workflow, but do know there's other ways to administer tests. So if you think about your typical visit, a patient walks in, especially if it's an eval day or even a first-time follow-up, they're going to, check in with the front desk, probably fill out some additional paperwork. In the ideal scenario, there's other staff members, whether it's front desk or an aide, that can help you set up your patient profile in Sway. And even if it's the, PT or OT doing it themselves, you can do this on the iPad itself or on your computer. You enter in their first name, last name, date of birth, as well as their sex, height, and weight. Height and weight don't really matter. They don't factor into our norms. They're just there from a research standpoint. So if you're a little bit off on those, that's okay. What's most important is sex and age. That's what our normative data is based off of. I do want to note that this test can be administered in English, Spanish, or French. So there's a little language button that you can click in the upper right-hand corner and toggle between languages. So you're setting up that patient profile, and it's time to bring the patient back. I'll move my little bubble over here. And once that patient profile is on the iPad, whether you create it there or it's on the web portal, you just refresh the iPad and that profile is going to be there. You're going to hit the gray Take Test button. Once you hit that, then you're going to set up what modules from that wheel of tests you want to administer. Now, there's going to be scenarios where the patient's running late, but you still want to get an objective measure before you start your session. So by hitting that Take Test button, it's going to give you a ton of flexibility to pick and choose what modules you have time for and you want to administer. The other important piece when you're thinking about timing and then eventually thinking about billing is we have two options. We have a screen or an assessment. A screen is very short. It's only one trial of any particular module that you choose. The assessment is going to give the patient a practice trial and then 2 to 3 trials after. So really from a post-injury or rehab standpoint, the assessment is what you're going to want to do because if it's the patient's first time ever taking a SWAY test, the practice trial is really important to help them understand the learning curve, especially how to bring the phone to your chest and what to do. And then you'll get multiple trials to give you an accurate assessment of what their capabilities are. So basically, once you set up this testing procedure on the iPad, then you're going to hand the phone over to the patient. You can adjust the language here if you need it, and then you'll take them through the modules that you have set up for them. So that's really the nuts and bolts. Once the test is completed on the iPad, results are going to pop up on the iPad and on the web portal as well. So you can view them anywhere. If you have an aide administering the test in another room, you can refresh your web browser and see the results come up before you go in to talk to the patient and help interpret them. So we'll skip through this piece, but do know that the patient can download the app on their phone and enter in a code that you create for them. And last but not least, everyone's favorite topic, just a little bit about Medicare and documentation rules. So of course, we're always trying to, justify our time and make sure that we're getting reimbursed for all of our skilled knowledge, therapy, technology, all the above. So these are some of the common CPT codes that SWAY is used with. We'll focus more today on the PT/OT side. Hopefully all of these codes look relatively familiar to you. We will highlight today this 97750, the physical performance test. From a balance and cognitive standpoint and SWAY testing, you can always roll the testing into NeuroReEd or therapeutic activity if that works better for your schedule. That's what your billing team recommends. Maybe the reimbursement rate is higher for those than it is 97750. Of course, run all these codes with your team, with your billing department, and it's going to depend on certain payers and plans for what reimbursement actually looks like. So as I mentioned, we'll just go a little bit into 97750. This is what I used for my SWAY test when I was in the clinic, just to bring a little more diversity into my billing instead of just rolling it into NeuroReEd. And at the time, we were getting pretty good reimbursement rates on this code. So these dollar amounts that you see here are actually, I think, 2024 CMS averages. Again, it's going to depend on state, payer, plan, all the above. But 97750 is a unit-based code, so that's where the timing of how many modules you administer, are you using the screen or the assessment? It's all time-based. So these are actual scenarios of times where I set up patients and the time it took me to set them up, review the results, administer the test. All of that is billable time, and these are a few examples of that. Now, for anyone that is familiar with 97750, there are a few caveats and important things to remember about this code. It's required that you have a separate PDF with graphs and visuals. So our SWAY PDF meets all of those requirements. And on that PDF, you have to write an assessment as to why this test relates to the patient's plan of care and function. And so there's a note section on every SWAY test. You can type out your assessment and it'll populate on that PDF report. And the most important piece, this code 97750 cannot be performed on the same day as an initial eval or reevaluation. So important to think about when you're treating your concussion patients, this, or any patient really, this has to be done on a daily visit. So in the concussion realm, how I structured my intake of these patients, right? On the first day for a concussion, there's so much you got to cover, so much education. I always prioritized aerobic exertion. I wanted them on the treadmill or bike on the first day, almost no matter what. So between all of that and symptom management, talking to parents, etc., I didn't really have time to do a full sway test, which was fine by me because I knew that I wanted to do that on the first time follow-up. So on the second visit, if I could finagle my schedule so it wasn't too, overbooked in one hour, that's when I would administer the sway test, use this code on my second visit with my concussion patient. And that's really it. So hopefully I'm gonna put my face over there. If you guys ever have any questions, this is my contact information. You can call or text that number, but also just shoot me an email. Happy to, uh, help you guys in any way. I hope this information was helpful and have a great day.